Hi, I'm Debbie, I'm 24 years old, I've got cystic fibrosis. Cystic fibrosis affects the internal organs, especially the lungs and digestive system, which makes it very hard to breathe and makes the lungs very susceptible to infection. And it does involve a pretty intense daily treatment regime. Every day of your life, you can't just, not do treatment one day. You've got to do it every day to just hopefully prolong the lifespan, which is currently averaging at 41.
The nurses who work on this service are a special bunch of people.
Hi Debbie, how are you? Thank you.
They are highly qualified, they've worked within the NHS environment, and they're highly skilled people.
And I really enjoy it because I just meet people from all different walks of life. So every day you're walking into someone's house and you don't just get to know them, you get to know the family and their friends.
I think the way that healthcare is going at the moment, it's going towards home care. And healthcare at home is uniquely placed to provide that service.
We will cover pretty much any condition. Any ward can phone us with a patient they think is suitable. We will go and assess the patient. As long as that patient has got a bit of support at home and is medically fit, if we can go in and see that patient, we will, whether it's to give them IVs, to do blood tests, teach them how to do injections, just to give them a bit of reassurance for a couple of days if they've had a major operation.
They're getting the same standard of nursing and physiotherapy care, but just in their own environment, so the patients are happier. And if you can match patient expectations, we get a much better outcome in terms of our surgery. It's giving the patients what they really wanted.
The patients absolutely from day one feel reassured, they're calm, they're happy, and they're in their home environment.
Nobody likes being in hospital. It can be really noisy at night, it's busy, it's hot. So the quicker the patients can get home, the better.
Where this is so different is that the patients are still under the care of the consultant within the acute hospital. These patients wouldn't normally be ready to be discharged into their own home. Part of the service that they have is a 24-hour helpline that's available to patients. They provide a rapid response team 24 hours a day, 7 days a week.
We have a 24-hour care bureau, which is essentially a manned telephone line. It's manned by qualified nurses, which the patients have access to 24 hours a day. So they are given the telephone number, they can phone, even if it's at 2 o'clock in the morning and they're just feeling a little bit unsure.
I thought we would see patients coming back with some problems, and we'd probably have to do some teaching, some training and some guidance, but interestingly that's just not been the case. I can't think of a case that's come back in where I've regretted sending the patient home early.
There's been about 1,200 patients referred onto the healthcare at home service. For us has meant that 7,600 bed nights that would otherwise have been consumed in the hospital have been in patients' own home. There's been around 10,000 home visits from the healthcare at home team, and that's amounted to about 35 to 45 patients at any one time that are on the healthcare at home service who would otherwise have been in hospital beds here within the acute hospital.
It's a win-win situation, for want of a better phrase. It's great for patients and it's great for us because it releases beds for more patients.
So it means I can still carry on with some normal things, still walk my dog, be with my husband, and so it's really helpful.
The rehab element of it, when you're sat in a hospital bed, you don't have to get up and make a cup of tea, to change the channel over on the TV or find the remote control, or maybe walk as far to the toilet or what have you. So you do more for yourself when you're at home than when you're sat in a hospital bed. So the patients recover more quickly.
Give it a few years down the line, it will just be the norm, to be honest. I think because it's still quite new and it's very fresh, people are a bit hesitant, which is normal because health is obviously a serious thing. But I think if you talk to any of the patients that we've looked after, they all just absolutely love the service. And to be honest, I don't know why it didn't happen sooner. Keeping
patients in hospital unnecessarily is both expensive and also does cause further problems for patients. So getting them back to their natural environment, getting them home, certainly if I was a patient, that's what I would prefer.
The service that healthcare at home provide is a really good middle ground in terms of the fact you don't need to be in hospital. and you don't have to be left at home totally on your own. They provide that extra support which allows you to live independently and carry on with as normal life as possible.